I will be very brief. First of all, I would like to express my deep sympathy to Mrs. Spyra, because the situation she has described is indeed a very difficult one. But the Commission only has very limited legal possibilities in the area of health. It can make information available. And this is in fact done on a large scale. Mrs. Marta's organisation is involved actually in many Commission projects now, and makes large use of this information that we're able to provide. And this project and the information are made available to Member States, but it's the Member States who then have to make use of that information. The Commission has no influence over what Member States decide to do with that information. It is up to the Member States who have to implement that. And that's really all the Commission would like to say on this subject.
Grazie.
Thank you. Mr. Sonik.
Thank you, Chair. I would like to say that I greatly appreciate the efforts of Mrs. Spyra and Mrs. Mader. I appreciate their efforts and their actions aimed at introduction of such standards of perinatal care. I admire their devotion. I believe that it is indeed an obligation resting upon every country to introduce such standards. Now, a lot is said about the costs, and I'd like to ask Mrs. Spyra, do you believe that the financial issues are important here? I think somebody mentioned here that some savings, but how do you view this?
Walesa. No. No.
Dziękuję, Pani Przewodnicząca. Szanowni...
Thank you, Chair. The petition by Anna Spyra concerning pan-European perinatal standards is close to my heart. For a number of months now, I have been in touch with Mrs. Spyra and have been following these developments with great interest. And in my case, it was rather difficult. The problems covered in the petition are very important. What we're dealing here is lack of regulation or insufficient regulation in some member states concerning standards in healthcare, and ensuring the right facilities, sufficient facilities and procedures in labour vis-à-vis newborns and mothers. There are legal gaps in this, and therefore the result is the situation we're dealing with here today. It is hard to say whether some actions taken by medical staff or whether the facilities are enough to ensure the safety of newborns. I believe such regulations, advocated by Mrs. Spyra, would create a point of reference and a benchmark. They could be a clear point of reference, especially when it comes to preterm babies. That is why I support Mrs. Spyra, and I believe that in the EU we should have some regulations concerning perinatal standards. We can't forget that every newly born citizen makes Europe stronger. And my question to Mrs. Spyra now to conclude, what should be the scope of such standards? What form should they take? And do you think they would make a difference? And if they had been in place in the past, would your son stand a greater chance of a better life? And a question to Mrs. Nader. What is your position? How do you view such standards in Europe? And I have two questions from my colleague, Lydia Göringer de Oedenberg, who couldn't be here today, unfortunately. She asked me to pose these two questions on her behalf. What possibilities do you see in terms of changing such standards? Do you think this is possible? And what kind of savings in terms of costs and family life?
Thank you. Nobody else wishes to speak, so I will give the floor to the Commissioner to reply.
Oczywiście.
Well, first of all, I'd like to thank for these questions. There's a number of them, but I try to be brief. Now, introduction of standards and legal regulations. All guidelines, all regulations, if they were now a normative act, a legal act, I think they would make it less likely that there is insufficient facilities, insufficient equipment, life-saving equipment. The European Commission said that the member states have the prerogatives here. But if we look at poor member states, would they agree to that? Because obviously we're talking here about equipment in hospitals. But can we allow for a situation where 10% of preterm babies, they acquire oxygen supplementation, they acquire incubators, and there is insufficient equipment in hospitals? These children, these newborns, these vulnerable newborns will look like my son does now. There was insufficient equipment in his case, and he wasn't breathing, although this very hospital should have possessed an incubator and oxygen supplementation equipment. There are situations where women just don't know where to go. They think about where there might be an incubator available if they know that they will deliver the baby prematurely. This is unacceptable. There are certain guidelines, but they are just recommendations. There are certain recommendations concerning the behavior of medical staff, but not equipment. This is left in the competences of the member states. But equipment is crucial. Parents like myself have to give up their jobs, and very often families just can't take this burden. There is a greater number of divorces. Who's going to take the blame? Who's going to maintain these families? Who's going to pay the costs? I think the EU should help such vulnerable parents. And we know that we're dealing with a very low birth rate in Europe. Parents don't want 2 or 3 children, but maybe it would be more cost efficient to ensure that there are certain standards in terms of safety, in terms of sufficient perinatal care. I'm not talking here about all the kinds of services and all kinds of procedures. This would be too difficult, but maybe supporting a pregnant woman as a client of healthcare services. She should be protected. She's the one that decides about the future of her child. We can do everything we can as mothers. We can take care of ourselves, but sometimes we just can't make it to the hospital. Sometimes we can't plan for 9 months. The labour might come earlier. We can't plan for everything. Thank you very much, and I'm sorry if I didn't answer all the questions. But obviously, it's not easy for me. Thank you.
Grazie. Penso che...
Thank you. I think you've answered all the questions. Nevertheless, I think we have other questions in our minds, and I therefore think we should keep this petition open so that we can call on the Commission to approach this differently. We understand the limits of the different institutions' powers, but maybe we could take some initiative vis-à-vis local authorities, and at the same time we could ask the Commission to rejig the financial instruments it mentions in its communication. There are different ways of putting forward projects to the European Union in order to give better access to good health, and this might be a way of helping those countries who can't or find it difficult to adopt European standards, and from where we get these alarming reports. So we shouldn't be carried away by emotions, but at the same time, I think we should keep the committee's attention focused on this and do something in the two areas I've mentioned. So if nobody objects, we'll keep it open. We'll close the debate for today on this petition. So thank you to the petitioners, and we will keep in touch about the future progress of this petition. I'd like to move on now to the next item, which is